I don't think we should be unduly worried. It's good to be concerned, of course, and the figures are important to let us know how much prevalence there is in society. But we have been at higher points previously, not so long since, actually, and most of society didn't even really notice. The fact is that there are new variants, but they are not more malicious, more dangerous than the earlier variants, and the vaccines do seem to be coping equally as well against these. So for the moment, I think it's, as I said, not too much of a worry.
Will be dubious about data on COVID, should they be?
No, I don't think so. The ONS survey has been the most accurate since we first got to grips with COVID and what was happening in the days when we didn't have those vaccines that we've just been seeing. So things have changed enormously since then. One of the bigger problems is potentially that coming into winter, that there could be a combination again of COVID and flu is probably more worrying to most medics right now, I would suggest, looking ahead to this coming winter, Paul.
Yeah, we know that there are quite a lot of people in hospital with COVID. What we don't seem to know is whether they were there for other reasons and have now been tested positive for COVID, or whether they've gone in for COVID. Is that right?
Yeah, in a nutshell, Anne, it is. The data seem to suggest that around about 1/3 of those in hospital are primarily there for COVID. The others are called incidental infections. But also, we don't know how many contracted while they were in hospital as well, which is another factor, because it is obviously just still all across society everywhere. It's almost impossible at this stage to isolate from it. But again, those in hospital with COVID aren't often very seriously ill at all, because mainly of the natural immunity that's built up and also the vaccines, which are still doing a terrific job. And the death rates, although they're a lot slower to catch up, if you like, obviously people who are being infected now and may sadly subsequently die of COVID won't be registered for a few weeks at max and a couple of weeks minimum, then they're still really stable and relatively low. It's a horrible thing to say that 23 deaths a day is low, but that's about the size of it at the moment. And considering the wider population and other causes of deaths, that's not an alarming statistic at all.
It doesn't sound like you're worried. Some people are suggesting that maybe we should be wearing face masks again. I know you're not a medical expert, but what's your feeling about it?
Well, masks certainly do help deter the spread. There are still some people who would argue that, but I think it's pretty widely proven. But also a lot of people who are against masks just will refuse to wear them anyway. And so mask mandates themselves don't seem to do as much good as a lot of people would like. Whether we should be wearing them now or not, I don't think there's any need at the moment. I think the need will come and everything will change if, and it's a big if, it's not necessarily going to happen, we get a new variant which is more resistant to the current treatments that we have. And if that's the case, then obviously the things that Boris has so far said that he won't rule out but won't take any action, like masks and like further isolations and heaven forbid another lockdown, that could come back into play. But I think those are extremely unlikely at the moment. And as I said, at the moment, like you just said it yourself, Paul, I'm pretty confident that nothing materially is going to change for people watching this programme in the next few months.
I think the alarming thing, though, for a lot of people is that not only it's like, if you haven't had it yourself, you know somebody who has. But actually, we're all becoming increasingly aware that we all know people who've had it more than once. I don't know whether you have any data on that, but it's quite alarming, the idea that you can have it once, twice, 3 times.
It is, because we've, I think, been brought up and come to think in the last couple of years of COVID as this very dangerous disease, which it was initially, now less so. If we think about the number of people we know who've had a cold more than once or a flu type virus more than once, then it puts it in perspective a bit more. And it really is in that sort of category now. And I think we're expecting more people to die of flu in the coming season than there will be from COVID. So let's just try and put those things in perspective, and let's try to settle people down. As I said, flu is the main worry. Looking at Australia right now, there has been quite an outbreak. And again, you do get different strains of flu, and seasonally and over time. They do tend to come every 3 to 5 years, and we haven't had a bad flu outbreak for a while now. So I think that's something that the NHS and hospital managers and the Department for Health will be looking at even more so than COVID over the coming weeks. I still think that this little wave has got a bit more to go in terms of numbers, but not too much higher. And I don't think that it'll be causing society any real problems.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.